Okay, so welcome to tonight's workshop. I believe the workshop you signed up for is arthritis. Are we destined to have arthritis? And we've done a couple workshops talking about arthritis. And so with each of these topics that continue to show up, we want to dive into the topic a little bit differently. And so when you look up arthritis on previous recordings, that's Colleen, on previous recordings, we will be going over some different information. And I may be referencing back some of that stuff today. But really, I wanted to discuss the difference between osteoarthritis and subluxation-based arthritis. And I know that if you've ever received a radiology report from, any any imaging that you've had done, whether it's X-ray, MRI, you may see the term osteoarthritis. And I want to just dive deeper into that so we understand what that is. So first, let's talk about osteoarthritis. And anytime something ends in itis, that basically means inflammation. So when we're talking about arthritis, we're talking about inflammation of a joint in the body. And osteo refers to a bone, so inflammation of a bony joint in the body. So let's go here. So osteoarthritis, typically it is categorized as an overuse arthritis, and it's most commonly overdiagnosed or misdiagnosed. We're going to get into detail there, but an overuse. So I want you to think about repetitive motions, whether it's a desk job, it's a specialized job where you're a carpenter or in construction or electrician using technology. It is, you are continually doing a movement over and over and over, and it's causing wear and tear on a joint where the body cannot heal the damage to the joint as fast as the damage is being done. Now, more recently, there's finding that there's a component of metabolic disease and metabolic syndrome that is actually contributing to osteoarthritis. Because you look at what's the cause of arthritis, and specifically osteoarthritis, and there's a lot of unknown components. We don't know where it comes from or why it's there. What we're finding is that there's a metabolic component to osteoarthritis. It's diabetes of the joint. And when we're talking about a metabolic component, that means that there's a much bigger component, meaning it's not just the joint problem, right? Can't just go right up here to this joint and that's the problem. There's more of a systemic component of lifestyle that's contributing to why we see an osteoarthritis show up. So it's inflammation and it's painful. And it's not just localized inflammation. We're seeing that it's a systemic global inflammation of the body. So why do I care about this? And you guys have seen, if you watched the workshop on spinal hygiene, muscle strength, I talked about only 7% of adults are cardiometabolically healthy. Only 7%. Yeah, that's a small number. It's a big number in terms of the 94% are metabolically unhealthy, meaning we are at risk for chronic disease, period. That means there's heart disease. That means there can be an overweight or obese component. That means there could be diabetic or diabetes component. It's a huge problem. And so when we're talking about osteoarthritis and we're seeing that there's research attaching osteoarthritis to a metabolic component, and 94% of us are dealing with, metabolic disease, we are virtually all of us are in that category. And you look at what some of the docs and researchers are saying is that the ship we are on, it's unsustainable in terms of our health. Okay, we just can't sustain this level of stress to our bodies and the impact it's having on, our healthcare system and the dollars we're putting into that. So here's just a couple research papers I pulled up. But this says metabolic syndrome meets osteoarthritis. And this is just saying, we're seeing that there's a metabolic osteoarthritis component. And there's a connection there. And I highlighted the second component where hyperglycemia and osteoarthritis interact both locally and on systemic levels. So again, if we're talking about diabetes of the joint, that means that our body can't keep up with the level of sugar that we're taking in. And when we consume sugar, our body produces or secretes something called insulin, which basically unlocks the cell for our body to handle our blood sugar levels. If we take in a lot of sugar, our body produces insulin to unlock the cell, to tell the cell, yes, bring in some sugar. There's a lot of sugar, we got to bring it in and manage our blood sugar levels. But if we're eating a lot of sugars, our body's pumping out insulin. At some point it stops responding. And then you get into type 2 diabetes, where you actually have to start giving insulin through injections to help support the body to open up those cells to take in sugar. So it's really a body problem here. And we bring it up because osteoarthritis is a symptom of that. Okay, here's another one where we're going to metabolic syndrome associated with osteoarthritis. So we go to that first line. A meta-analysis confirmed an association between type 2 diabetes and type 1 is something you're born with. Okay, so it's written in your genetic material that your body doesn't have the insulin and the ability to take in that sugar. Type 2 is lifestyle. So association between type 2 diabetes and osteoarthritis, and between cardiovascular disease and osteoarthritis. Metabolic diseases induce and aggravate joint damage, if you continue following the highlights, and it has a direct systemic effect on the joints. And you go down to that last component. Finally, exciting data is emerging that there's an association of gut microbiota, so your gut health, with circadian rhythms, so your sleep, and your metabolic syndrome associated with osteoarthritis. So when we're talking lifestyle, we got diabetes, heart disease, sleep, we have impact of your microbiome or your gut health, and then you get osteoarthritis. Okay, so I want you to start seeing that this isn't a joint issue. This is a body issue. This is a lifestyle issue. Okay, and you're not going to hear this from your healthcare provider. If you get x-rays taken and you see osteoarthritis show up on your x-ray report, they're going to say that this is common, this is a part of aging, and it's wear and tear. Well, outside of our standard American lifestyle, you go back 30, 40, 50 years ago when we tended to be healthier, not carrying the weight that we are, consuming different types of foods, moving our bodies differently. Yes, it was probably a wear and tear sort of thing. But now we're seeing the metabolic component where it's a much bigger issue. So again, I went over this in the muscle strength workshop where I talked about metabolic health. But when you have poor metabolic health, we see increased obesity rates. I highlighted cardiovascular disease. I highlighted osteoarthritis. I have highlighted body-wide inflammation because it's a systemic problem. And then you can see the rest of the list here that's associated with poor metabolic health. Okay. Now, I want to talk about osteoarthritis, and I want to talk about subluxation-based arthritis because they're very different, and you can have a combination of them. And understanding the state of our health in the United States, 94% of us are metabolically unhealthy. There's, of course, probably going to be a lot of crossover there. But we want to make sure you understand the difference between the two because they're different root causes there. So vertebral or subluxation-based arthritis. Okay, this is more of a biomechanical issue, meaning the joint isn't moving appropriately, it's moving too much, or it's not moving at all. And when it's not moving, and a joint is meant to move, right? When a joint is moving in a healthy way, that means that it's getting good nutrition and good input to maintain that health. Subluxation-based arthritis means that there's a biomechanical issue where that joint's not moving appropriately for long periods of time, and you start to see degeneration around that joint take place to counteract that stress. We're going to look at that in a second. So it's not a wear and tear sort of thing. And whales and dolphins are a prime example of this because they don't have the gravity that we do, but they are certainly going through same repetition and movement over and over, but they're in water. And yet we see that they get arthritis. And that's because there's a joint in their body that's not moving in a healthy way. And that's where you start to get breakdown. Okay. So when we look at subluxation degeneration, I want you to think about its immobilization degeneration. It is a joint that's not moving in a healthy way, and it doesn't move in a healthy way for a very long time. And that's where you get degeneration of a joint. Okay, so malalignment of the spine, poor movement or abnormal movement. And the body tries to compensate for that. And it's a healthy process, but it's a problem. So let me just see here. What if you eat no bad sugar and you still have this in your fingers? That could be a different component in terms of arthritis. But again, it's not just about it's not just about what you eat in terms of looking at overall inflammation. But I hear you, Colleen. We can chat about it when you're in the office. So I want you to think about subluxation degeneration. It's the health of discs, the health of your joints, and if we see any calcium deposits. So I'm going to see if I can use a annotation here. I'm going to draw today. So we're looking at this spine right here. Okay. And this person is facing this way. Okay. So you guys can see that too. And so when you feel the bones right down the middle of the back, this is what you're feeling back here. Okay. And we should have a nice C shape in our spine. Okay. So that spine should be nice and C shaped. And they should be stacked along here. So when we look at this, this is actually the report for it. Okay. So cervical spine, reversal of the normal cervical lordosis. Now, lordosis looks like a banana back here. Okay. So the first indicator that we have a phase 1 degeneration in a subluxation type arthritis is we have a change of the curve. Okay. When you have a change of the curve, that means the compressive forces are acting differently on that spine. And so what we see over time is we start to see disc space decrease. So if you look at these guys right here, look at how nice, thick, fluffy this disc space is right here. See that one? Should be nice, thick, fluffy. This one looks pretty good too. Now we get into these ones down here, we're starting to see decreased disc space. So that's compression on a disc. And we've got abnormal compressive factors acting on that spine. And what happens is the body starts to build up bone around that joint. So if you look here, you look at this corner too. I'm going to give you an error here. Look at that corner. That should be nice and square. So when you see disc space narrowing and spurring, okay, that's indicating a joint health and disc health. And when you have spurring, that's talking about a calcium deposit. Okay. And that is really a body moving through degenerative changes to create natural fusion because there's instability or poor movement there. Okay. If you ever see stenosis, we'll look at that in a second here, but stenosis is really bony buildup around a hole. If you're looking at the spine, if we have a hole in the spine where a nerve, vasculature exit out, if we have bony buildup around there, that's stenosis. Okay, so when we typically see these types of presentations, we look at this more of like a subluxation degeneration. Okay. Now, when you see anterolisthesis, anything that is a listhesis is a sliding. Okay, that means a bone has slid forward or backwards. Okay, so when you see grade 1 anterolisthesis of C3, so here's 1, 2, 3, right back here. I just covered it up, but we're going to clear that so you can see what I'm talking about here. Right here is where that bone has moved forward on top of another. Now, we have or a spondylolisthesis. Oh, sorry, that's a different word, spondylolisthesis. We'll get into that. So sometimes you can have what's called congenital anomalies or congenital presentations of these things, meaning we're born with it. And then sometimes due to lifestyle and poor movement of the spine, we have progression of degenerative changes that take place. And what makes this more complex and complicated is that we've got that metabolic component of if we are metabolically unhealthy, we have systemic inflammation, then we start to see breakdown happen in a joint as well. I'm giving you guys a lot of information here. Are you with me so far? Yeah, okay. Hope you guys are with me on Zoom. I can't see you, but I want you to be able to understand that there's a difference between the two. And if you're addressing one, I mean, you can address your joint health and how you move. That's what you're doing here in the chiropractic world. We're doing a great job of making sure you are moving in a healthy way and you have healthy alignment. The biggest thing is, and this is why we do workshops, is that if you are not implementing other components in your lifestyle, you are still in a place where your joints can be breaking down. So let me exit out of this and let's keep going. What else did I show you here? Oh, here's another person. Let me take out all my stuff. So here is, can I just clear, here it is. Okay, clear all drawings. Thank you. So in case I want to draw. Okay, so again, we're looking at the same view. This is another person, and Doc did this drawing, but she actually drew the straight line back here, that curve that looks like a banana. That's where that person's curve should be. And you can see the dashed lines. That's where she followed this person's spine. So when we know that there's curve changes, that's abnormal compressive forces on that spine. That means that they are in a subluxation-based degenerative presentation here. We know that we can see some changes that are happening, you know, depending on their age and their lifestyle. So let's look. If we look at this disc space, looks pretty good. This disc space looks pretty good. What do we see here? We see a disc space changing at this level. And does this vertebra look nice and square? What about this next one? That's where we're seeing a big problem right here. That's where we start to see bone spurring. And we're seeing, you know, a movement towards connection. If this person doesn't address the subluxation and doesn't address the healthy movement in a spine, we're going to see, you know, this move towards fusion over the years. Now, in order for these types of changes to show up, it's probably been around for 20, 30 years. So it's been around for a long time. And we'll get into the definition because I looked up the Mayo Clinic and said, okay, well, what is spondylosis? We're going to get into that. But you can see that they use the term mild facet joint osteoarthritis from C3, 4, 5 down to C7. So here's 1, here's 2, 3, 4. So starting at 3, 4, all the way down to here is where they're seeing facet osteoarthritis. So that's where we're looking back here at the facets. And we're going to look on another, can I go to the next page? We're going to look at the next one because we have the front view here. So let's clear all of these. Can I go to the next one? Is that okay? Okay, let's exit out of here. So here's that front view of the person. We're looking at their backside. Again, Doc followed their spinous down. So those bones that are sticking out, she followed them straight down. Those should be nice and straight. So not only can you have a change from the side view, you can have a change from the front view. And when we get these lateral curves that are showing up, again, what's that impacting in terms of compressive forces, right? So we see a head that's, let me get my annotations here. So we see a head that's tilted here. Oh, I don't like that. And then we see a lot of change happening. And again, when you have shifting happening through here, let's look at the joints over here. Okay, look at how much bigger this right side is. And I'm saying right because this is the R standing for right. Look at how much bigger this is over on this right side compared to this side. So that's showing that we've got, you know, joints that are changing. Even look right here. This is called an uncovertebral joint. Right here, I'm going to take that off so you can see it. I'll make it smaller. Right here is called an uncovertebral joint. They should be symmetrical both sides. Look at this right one compared to the left one. Look at how big this is. Uncovertebral joints typically look like cat ears. Okay, so you see a real big cat ear on this side. What do you see over here on this side? Look at this side down here. So you're seeing a cat ear, don't see much on this. I mean, really, we're seeing lots of, well, here's where we're seeing this. This is flattened out and gotten a lot flatter through here. This is where we're seeing a lot of change right through these two. So this is what this medical doctor is calling osteoarthritis. Right through here. And frankly, I don't know, and I would love to talk to a radiologist to understand, when are you calling something osteoarthritis and when are you calling something spondylosis, which we're going to get to. Are you guys following me so far? I just want you to, we've taken x-rays on you guys. You've seen your x-rays, so you can actually go through and start to look, oh man, I've got some subluxation-based degenerative changes happening in my spine. And if I start getting adjusted and get healthy movement into those joints, I can help counteract that progression moving forward, right? I can change how my brain is fed information. And yet we have this underlying component that if we're not addressing our lifestyle, then there's a component that, you know, this breakdown is going to continue, not just, you know, in our joints, but in our bodies. So why is it confusing? Because this is what the Mayo Clinic said. I said, well, what does the Mayo Clinic describe spondylosis as? It's a general term for age-related wear and tear. Right away, they say wear and tear. So what do we think? Osteoarthritis, okay? Affecting the spinal discs in your neck. As the discs dehydrate and shrink, you have signs of osteoarthritis that develop, including bony projections along the edges of the bone called bone spurs. But what did we also just go over? That if your spine is not moving appropriately, and if your joints aren't moving appropriately, and you have changes of your curves and those compressive forces start acting differently, that's a subluxation-based arthritis. So we're confused because we're lumping, I mean, that we're just not clear on what arthritis is. And so they say cervical spondylosis is very common and worsens with age. Now, here's the thing. If you've sat through your report with Doc and I, you know that what science has told us is that our spine should maintain its structural integrity for between 90 and 125 years before breakdown. Really? That doesn't mean at 90 we go kaput. That means that's when it starts. That's what science and researchers have found. If we maintain a healthy structure, we are designed to last a long time. And if we're moving in a really healthy way. So here's the big issue, is that when something is seen over and over and over and become common, it's become normalized. So when you're going to your medical doctor and they saying, oh, osteoarthritis is very common, that's expected as you age. Okay, that's because the lens they're viewing things through is that they see it all the time. They deal with sick, unhealthy people, and it's just normal. And I'll tell you, normal is healthy. Normal is a vitalistic expression of health. Normal is being able to function and, you know, do the things you love to do at 20 and do the things you love to do at 80, right? That's normal. And so you've really got to consider who your healthcare providers are, because do you want to look at You want to be seen through a lens of disease and illness, or do you want to be seen through a lens of health and vitality, and how can we reach health? You know, frankly, I believe I was talking to a radiologist, and I think it's the liver. They used to talk in reports. They used to define, oh, the liver is showing some fatty tissue or retaining some, you know, some water or something. I think it was the liver. And the radiologist said, you know, we see it all the time now. It's not even reported. So they don't even include it in their reports anymore because it's such a common presentation. And when we have that common presentation, it's normalized. So why are we confused is because, you know, we look this up and we say, oh, it's wear and tear. This is something that's common. As I age, I should just feel older. I should just move less. I should just be on prescription medications and just start to gain weight and all of these things. And I tell you, you are not destined to have arthritis. I just told you what's normal. If we take care of our spines and we take care of our bodies on a regular basis, daily, then we should be aging in a very healthy way. But we live in a world that common is normal. You look at the average person's health and it's not good. 94% of us are metabolically unhealthy, we are at risk for chronic disease. Osteoarthritis is attached to diabetes, it's attached to cardiovascular disease, and it's attached to, what was the other one? I'll have to go back to it. Metabolic syndrome. We know metabolic syndrome is the umbrella for chronic disease, period. And so that's where we really got to get clear on health care versus sick care. So what'd you learn tonight? Let's just circle back to really wanting to identify the difference between osteoarthritis and subluxation-based arthritis. And really, when we get to the average person here with 9+ out of 10 of us who are, you know, probably having some challenges with our metabolic health, we're going to see both of those. When you get adjusted, we're helping take stress off of the brain. We're helping the spine move in a healthy way. But if you're not taking other action to really address the lifestyle, you're not really shifting your trajectory in a big way. If you want 10, 20, 30 years to look different for you, it takes discipline, it takes work, it takes an investment in your health in every way. And our current world does not set us up to succeed in that way. You know, they are saying, take the path of least resistance, do what's easy, you know, don't get up and don't do the work. It's hard, you know, that's too hard. Don't worry about that. And we're asking you to do the hard thing. We all want to age in a way that is healthy and vitalistic. We want you guys to be with us for decades, right? We really do. This is a community and a family here, and we want the most for you and your family. To change what's going on in our world and to change what's going on in our community, we really need help here. Dr. Chris and I can't do it on our own. Our team can't do it on our own. And this is more to not just change and support your health and lifestyle. It's really to change the people around you, change the community, you know? So if you have questions, Colleen, I'd love to connect with you when you're in the office. But if you have questions, please connect with us. But know that we really appreciate and value the fact that you're here with us on a Tuesday night, because not everybody is showing up for a workshop on a Tuesday night to understand the difference between osteoarthritis and, you know, subluxation-based arthritis. And probably 98% of people have never heard of subluxation arthritis. Even if you talk to your doctor, they'll say, I don't know what that is. It's osteoarthritis. And we know it's not, it's different. But we're seeing that both those presentations happen. If you have a report, an X-ray report, an MRI report, Doc and I are happy to go through that with you. They use a lot of big words, but we can break it down for you pretty easily. And we can talk about how your chiropractic care is supporting you to stop that from progressing or moving forward. So love and appreciate you. Thanks for being with us tonight. And we'll see you next time. Yeah.